Hi, I'm Phil Romzek. This is me at over 500 pounds. A few years ago, I worked with Cornerstone Wellness products to lose 262 pounds. I've kept the weight off. I continue to keep the weight off using Cornerstone Wellness products.
Hi, I'm Christy. I used to weigh 287 pounds. I lost 117 pounds using the Cornerstone Wellness program.
Hi, I'm Rick. I lost 127 pounds so far with Cornerstone Wellness. 91 pounds of that was fat. I've been able to get off several different medications, and I owe it all to our life coach, Megan.
My name is Elizabeth. I've lost 87 pounds, and 65 pounds of that is fat using the Cornerstone Wellness program.
Hi, my name is Dr. Brendel. I've lost over 170 pounds on the Cornerstone Wellness program, of which over 140 pounds was fat. Thank you very much, Cornerstone Wellness.
Okay, hello.
Hi.
So the Fab 5 2025, 5 patients, 750 pounds. Those are your patients. And they're not the only ones you've had that success with. So thank you so much for coming on today to talk with me about it. Megan, I of course know you, but could you introduce who you are and where you are in regards to the wellness program?
Yeah, so our clinic is an endocrine clinic. We're based out of Port Huron, Michigan, for anyone who kind of wants to know exactly where we are. So we're a small community, or a smaller local community. And I operate out of Lake Huron Medical Center. Info about me, I'm an exercise science major. So I have a bachelor's in science and I have a nutrition minor.
Okay.
And this is my 6th year, I think, with the clinic. Yeah, 6 years. So kind of cool.
It is cool. And I was just looking at records. It looks like you work with about 220, maybe 250 patients a year, unique patients. So you have one endocrinologist, one nurse practitioner, and referrals from community.
Yeah, so I guess I'll kind of tap into that a little bit more because it kind of, I guess, highlights more of like how closely connected we are here. So before this job, I actually used to work for the endocrinologist who retired from here. I used to work for her husband in a cardiology office. So I used to do cardiac stress testing. So kind of connects really well with what I'm doing now with nutrition and talking about that. But both providers in our office alongside of that clinic send me a lot of referrals. And then I get referrals from people in the community who hear our radio ads, or they're going to our website, or they know somebody who I've worked with. So I'd say that's where most of them come from, but a lot of them would be more internal. So in our medical group, if it's not coming from the 2 providers that I work with, either Dr. Bala or Kristen, it's coming from someone else, primary care.
Right.
So we have that connectivity too.
You insurance-based? Is it a
I
cash?
think
Is it, I'm sorry, Marina. Is it a cash-based model, insurance-based model, both?
So we don't necessarily do cash pay. We kind of can't anymore. But we accept most insurances. We bill through insurance. So pretty much everything on our site is done that way.
So the Cornerstone program, as far as a body composition testing, how integral is it body comp testing with what you do? Are you using it on a every appointment basis?
Yeah, so the integration of the platform is something I use every day. I'm using obviously the website for the body composition testing. And then I kind of bounce back and forth with the materials that we talk through. So like the meal plan booklet, the shake use. I think I kind of bounce around between all of that depending on what the patient needs to talk about. So if it's like a diabetes education appointment, we're going to talk about carbs and protein. We're going to educate on why that's so important, that kind of stuff.
So on an initial appointment, how long is your first appointment compared to follow-ups?
So that varies so much. First appointment is, I would say people are in and out within an hour and a half.
That's a long appointment. Okay.
I spend an hour with the patient initially. And it's because we're doing a lot. We're doing the dietary analysis. We're doing the body composition test. We're going through the results. And then I'm kind of going through that meal plan, and that takes probably the bulk of the visit.
The Cornerstone shakes, MetAssist, and OmegaHealth, the three supplements, obviously around real food, which is what we all
Yes.
teach. How integral are those to what you do?
I think they're pretty important. They're probably one of the top focuses, I would say, of the program in regard to nutrition, because I think as a good health coach, that's one of the biggest things you have to do. You have to listen to each patient because they're different. I find a lot of times with women, especially, it's really hard to talk about getting enough protein in diet. It's something that I think men are just better at naturally. They like
Easier.
meat. So
It's
I
true.
think with women, I probably talk about the shake use maybe a little bit more because that seems to be a constant battle.
Mm-hmm.
But I guess it depends. Like if I have someone who comes in who has fatty liver, we're going to talk about the importance of, healthy unsaturated fats. And the fish oil is one of the first things that I go to.
Mm-hmm.
The MetAssist, I mean, it depends on the person. If I hear someone
Right.
who says sugar craving, I'm probably doing that right out of the gates just because I know
Right.
that it's going to be a battle to keep them on track.
Right. Right. So on a first appointment, you're covering a lot of information
Mhm.
and it's nice. You have a dedicated amount of time, which is more than most coaches have on
Big
initial.
time.
But people can hold so much information, right? So
Yes.
when they walk out after that first appointment, what are the couple of takeaways? What do you want them holding on to when they walk out of that first appointment?
Oh gosh. So number one, let's prioritize protein. That's
Mhm.
probably the very first thing. So trying to make sure that they understand if they use the shake, that counts as pretty close to 30 grams. If they're
Right.
not using a shake, then they've got to still get that same amount of protein through a different food source. And
Right.
I try to keep it simple, like little visuals. The mouse,
Yep.
it's 4 ounces, right? It's about 30
Right, right,
grams.
right.
So just little things. Yeah.
Okay. So protein, right. And it's fat loss, not weight loss. I know that that's that
Correct.
big, I've heard when you talk to people that full emphasis on keep your muscle, right?
Yes.
So,
Yep.
and I would say what I would think is the importance that they know they have to come back to see you, right? So,
Yes. So that varies too, Julie, I would say. I mean, we're an endocrine office, so a lot of the population I'm working with is diabetics. So we
mhm,
are seeing them every 3 months, non negotiably. Sometimes we'll see them every 6 months.
right,
So we're repetitively re-hitting this information every time they come in. And,
right,
depending on, I guess, what's going on, we'll talk about if they're on a medication, like a GLP-1, why that's so important to eat the right way so that they
mhm.
tolerate the medication and then they get the results. So
Are
varies.
you seeing them, so as an endo office every 3 months, but are you seeing them on a monthly basis for the nutrition part?
Sometimes it depends on the person.
Mhm.
I would say a good portion, if they're really, really fat loss orientated, that yes, they are probably coming to see me every month for a check in. We're hitting the nutrition. We're talking about if we saw a plateau, why did
Right.
that happen? Was it diet related? Was it exercise related? Um, and then sometimes I see people like every 6 weeks if they're getting the hang of it. They don't
Right.
need it as much, but the accountability is big. And sometimes we'll see a plateau with those GLP-1s
Mm-hmm.
and we're thinking, is something wrong? And then we do the composition test and we see, well, actually, you gained 4 pounds of muscle and you lost 4 pounds of fat.
Which is great. That
So
means
we
they're
still
doing
use
what
it
you told them.
innovatively.
Right. Right.
Correct. Yeah.
So the GLP-1s are here to stay, right? They're here.
Yep.
And, forever drug, right? Forever.
Yep.
But most people I talk to think that they're going to be able to come off it at some point ahead.
Mhm.
Have you had anybody get to their goal? Have you had anybody wean back or off GLP-1 meds?
Um, Interesting question. And yes and no. Recently, I would say I've had some patients who have been forced to get off the GLP-1 because of the insurance changes
Mhm.
with coverage and cost, right? So I'm just kind of learning about that right now. I've had two really honestly that have had to come off of it because of the cost and insurance not covering it. And our biggest thing is, following up every 6 weeks so we can make sure that they're managing things appropriately. The biggest push with that is knowing their calorie targets for their meals, and then working in protein within those calories. And then I think the other reason they're maintaining is the movement. You're keeping that calorie deficit larger, so you're staying more on track because of it.
Okay. Part of it's intake, part of
Yep.
it's expenditure, exercise. So, you know, how do you motivate patients to exit? Because I know I was talking to somebody on that Fab Five, and he said when he first went in, he was in a wheelchair. Now he's at the gym every day. So, and knowing your passion with fitness, how do you meet somebody where they are and work out an exercise plan they can follow?
So that's hard to answer too, but yeah, I think number one, as a health coach, again, you have to see the big picture. I'm not talking about anything that's not in my scope. So I'm looking at diet, exercise. With that particular patient in general, we didn't have the movement ability. I was going out to the parking lot, getting him in the wheelchair, bringing him in, and that's how we started. So as he lost weight, it became more of like the next natural step that people want to know more about. And with his background, he was in martial arts, so he had that natural drive. So the first thing was just, can we start walking after surgery? Can we heal well? Can we start moving? And we talked about walking plans. Here's a 4-week plan that you can start with that just talks about how fast are you walking. Then we added incline, and then slowly that kept progressing, and we started talking about, you know, heart rate variability. What's a good number to be at if we're working at cardio? What's a good level to elevate that to if we're trying to lose body fat? And then resistance training, you know, you kind of want to start dabbing into that slowly. For the first bit, it might be body weight if somebody's not comfortable in a gym. You know, I try to meet them where they are. Like you said, you have to figure out, can they do it at home? Do they have the accountability? Do they need the support of someone one-on-one? So that's why, again, you know, the visits, I think that varies for me too. I have some people I see for a half hour, they're in and out. You know, we do the composition test, they see what's going on, they're stable, they're fine. We don't need to spend that time. But when they hit a plateau or they're stuck or they feel like they can't, you know, get out of whatever rut they're in, that's when they know they need to come in the most. That's what I try to educate on. If you're not seeing the result, if you're stuck, you need to come in so we can figure it out.
And you start reinforcing that from the very first visit, right?
Absolutely. 100%.
Otherwise, people get discouraged and, you know, and all they got was a snapshot, but they don't come back, right? So you're reinforcing there's going to be obstacles. That's when you need to come in the most.
Yes, 100%.
And as far as exercise, and I agree with you fully, you know, you can't have somebody jump into everything. So you start with nutrition, and as they feel better, you do what they want to do with exercise, right? What do you tell a patient when they tell you, and we've all heard it, I just need to exercise more. I just need to go out and walk more, right? But their body fat is drastically out of a healthy range.
Right.
How do you steer them to nutrition first?
So I look at, and this is something I probably say as a quote every single time I sit down with someone, but you have to have a good foundation there first, because we can intake 500 to 700 calories in 5 minutes of eating. So if you're really not looking at what you're eating first, it isn't going to matter what amount of exercise you're doing, because creating a deficit, if you're eating, you know, 3,500 calories in 2 meals, you can't burn 3,500 calories in an hour workout unless you're like Michael Phelps. So that is a tough conversation, but you have to have it, and they have to understand that.
And I like that that's something you're reinforcing right from the beginning, right? And then every time they come in, and if they're not seeing the results you expect, right, circling back to step one, do you reach out to patients that maybe came in once or twice, but they haven't come back? Do you have time in your schedule where you know that they dropped it?
Yes, I do and I don't. It depends on, I guess, the person and the unique situation. Sometimes in our area, it will be more financially driven for some of the population that we deal with. So in that case, Dr. Bala and Kristen, both practitioners, are really awesome about saying, well, the next time that you come in, we're going to double book an appointment with Megan. We want you to start talking with her again. So you have this like circle loop that you just kind of keep going with. And I think that's another thing in this small community that maybe outshines more than bigger groups, is we have that connectivity. And I think that builds trust
Three of
too.
you. Right.
Yeah.
All providers, all clinicians, the
All on the
three
same
of you are working as a team. Right. So
Yes.
that
Yep.
they make sure that the person's coming in.
Yes.
Okay. Yeah, that's huge. Are you having people keep food logs? You know, it's some people like to, some don't. I always think if you're measuring change in the right direction, you're doing it right. But
Yes.
tracking helps. So what do you do with that?
So probably not my first method in the beginning, unless I know somebody really needs to do it, because it's just trying to get them to trust me about this will work if you follow it.
Right.
But I do use that a lot of times, like if we had a plateau or someone feels like I'm doing all the same things, then I'll say, well, I've been doing this for 6 years and I can already tell you that I know that you're not in a calorie deficit, but I can pick it out quick. So I always say that that's really important. Another thing we started utilizing too was the CGMs, the
Yes.
Stilos. I don't know if you've heard of
Yeah.
those. You probably
Yeah.
have, right?
Absolutely. Yeah.
So we'll
Most of
use
your
that as
patients
like
use them.
yeah, I think it depends. A lot of our diabetes population will, but what's great is now, anyone on the street can go out and buy that. And
Right.
I will even reference that as an option for someone to see, because when they're seeing that glucose spike and they're trying to figure out what's wrong, it's a good indication that you either had too much of that food or it's not the right food. So we kind of integrate that too, depending on what the patient's open to doing.
Right. That
But
makes
yeah,
sense.
food logs definitely important. I think you have to reference them at some time.
So diabetic, and I know from when the program was very first brought in from Dr. Reddy, and it was really, I call it a diabetic boot camp, right? So when people suddenly realize they're, 13 or, sky high, it was an intensive program with the clinician, all three of you.
Yeah.
As your patients, and again, it's not just the 5, I've seen over the years, so many of your patients have these kind of results. What have you seen as far as obviously dropping A1C, but coming down and off of medication, be it insulin? How integral do you think that is? Or is that something you see all the time?
Yeah, I wouldn't say in every case we see it happening, because I do think it depends on the patient and how much they're willing to put in. But those who are making the lifestyle changes, who are doing the program, who follow the information that we're guiding them through, I would say most of the time it's happening. For sure, if they're diabetic, one of the first things we'll see is we'll reduce their insulin usage, or we'll reduce their pill burden. A lot of times, Actose or pioglitazone is one of the first ones we'll cut. Metformin is a hard second, and then depending on if they are on a GLP-1, it might escalate and happen a little faster, just because the nature of the drug and what it does. It's an agonist. It kind of mimics your own peptides you're making, but we kind of trickle it based off of how they're doing. And our biggest goal is we need to keep them compliant with the diet and tolerating whatever medications they're on. And the next marker I probably would say outside of A1C would be, blood pressures. I see that change pretty quickly early on and we'll cut that. And then sometimes we get them off. So that's another great marker. Trying to think what else.
Yeah,
It really
lipids. Yeah.
depends on the picture. Yeah, lipids. That's another
Right.
good one for sure.
Right.
Absolutely. We'll see that change too.
Have you had patients that have gotten to their body composition goal, right? And you've worked with them, you continue to follow them over years. So once they've gotten to their goal, what's your protocol or plan for putting them back to, how do you put them back into maintenance?
So usually it's slowly and it's gradual. It varies based off the patient again, so that kind of is tricky. But I would say in general, we'll say, all right, you're at a good weight. Let's follow you back. Let's come back in 2 or 3 months. Let's see how you're doing. If we're pulling out a protein shake to replace it with food, we have that conversation of what that looks like. Because sometimes that'll be the one thing that'll change just a little bit, is they want to be all whole foods. And then I'll kind of see how that goes. When they come back in 3 months, if they're still doing the exercise, I usually don't see a whole lot of like weight regain. Sometimes it might be muscle more than anything. But the maintenance period, some people will track calories. I really think my people who tend to keep the weight off for the first bit are doing that because it's keeping them kind of
Accountable.
on top of where that, metabolic rate should be with energy expenditure. So we'll just talk about like, all right, breakfast, are you right around 300 or 400 calories? Perfect. Let's try to match that out through the day, you know, but the conversations are, usually pretty open at that mark. If we're having a problem again, they'll call me, they'll come back sooner, but increasing calories just slowly. It's never something that we do quickly.
One thing I heard from everybody that you're Fab Five, right? That we
Yeah.
we're keep referencing, was they all had a chance to share how they felt about you as a coach. And one of the line that just sticks in my head, I think Phil said, you never push anyone. You don't push, you pull
No.
people. You pull them
Yeah.
and encourage them. So can you address how important that motivation is? When you've got a wellness coach in a busy office trying to stay on track,
Yeah.
if you had to put that in a nutshell for having the patient know you care, right? And motivating them, what would you share with a new coach that was trying to do that? Big questions, yeah.
Yeah. Man. So, I mean, number one, you always have to have like that openness with whoever you're working with. They need to understand that when they're coming in, they're usually not in the best place. And you have to kind of pull them along with you. So, number one, you have to allow them to understand that you relate to them. You have to see the big picture. If, I don't know a way to put it easily, but I have to make sure that they trust what I'm saying. So for me, like I'll reference, we've all gone through a crazy part, in life where you maybe weren't at your best because you're in survival, there's stressors, but I want them to know it's an open relationship that we have. Anything they tell me, I'm not judging them. And I think that that's incredibly important for them to open up to you about where they're at and supporting them along whatever journey it is. Sometimes I have patients come in and we're not even always talking about food and exercise. We're talking about, I just went through this substantial loss. I'm having a hard time with this. And it's venting, it's getting it out. And then it's like that redirect, refocus. So it's not easy to do. And I do think because I relate with people very well that I've been able to do it. And I wish I could tell you exactly how. But you have to be open. You can't judge them.
I think the line that sticks in my head is, people don't care how much you know until they know how much you care, right?
Yeah.
That you can hear them. You don't have to go down a rabbit hole. I mean, people have these challenges that are,
Massive.
just massive.
Yeah.
But without going down that long path, but they know you care, you hear them, but what I will say to people is, I'm so sorry you've been going through so much. And the best way I can help you is to focus on the nutritional part, right? Because that's how I can help you. And to try to put them back onto track. So, okay, so we kind of talked about GLP-1s. We talked about motivation with people. One more question with coaches. Do you have an outline? I get asked a lot, what do we do at a follow-up? And I always say you celebrate or fix, right? You go where they need to go, always motivating. Do you have a format like, the first appointment, the second one? Are you trying to talk about sleep or food prep? Food prep. I do want to touch on that with you because you do a great job with that. But do you have a structure of at what point in visits, or do you go with where the patient needs to go?
It's a little bit of both. So like one thing, every time they come in, it's small talk for a couple of minutes, touching on how they're doing, what's going on in life. I'll be like, all right, what's going well for you?
Right.
Tell me what you feel is a success. What are we struggling with? And then the visit kind of changes based off of that. So that's kind of hard to encapsulate, but you just have to hear it. Sometimes it ends up being appetite, right? So some of my patients, they start off holistically. We're doing the shakes. They're doing really, really well. And then they might hit like a frustration point where they're going through a stressor and they kind of snuck some old habits back in, and they can't control appetite. They need something there. So sometimes we'll talk about like, all right, well, what are options that we can do short term? And my push there and our push with the office is this is not forever. You still have to be doing absolutely everything the right way. But I do think it's necessary to hear that. And I think sometimes offices aren't necessarily always open to that as much, maybe, but that's critical. You have to have that moment with that patient and figure out, okay, what do we pull on board short term that's going to help you get through this? And I think we've been more progressive with that probably in the last couple of years, where I'm trying to also understand that, yeah, I can't get over this. I need this extra help. So we talk about what the best option is, and then we go from there. And then the end goal is get off of it. It's not forever.
Right. And it's, I would call it tough love, right? You compassionate, but tough love of, look, for you to get where we're talking, this is what you have to do, right? This is the plan. So they know that you are 1,000% confident that they can do it if they do what they're supposed to do.
Right.
So,
there is no magic pill. There is no magic supplement. I mean, that's always one of the first things I say too. And we have to talk about the food, and that's always something that we talk about. And usually that's where it goes into meal prepping, right? We talk about, all right, what are you doing for the week? What does this look like?
I love
getting
that.
bored, getting tired. What do I do with this? So I do spend a lot of time on, all right, well, what's the recipe? What are you craving? What do you want? Do you want a comfort food? Is that what you've been craving lately? Yeah. All right. Well, how do I make a healthier version of that? How do I make that more calorically deficient for me?
Right.
So kind of customize it.
I'm sorry to interrupt you. You teach food prep. I know that, you take some time on a weekend and you lay out and you prep for yourself. I mean, you practice what you preach as far as, lay out your food for the week. Do most people find that doable?
I think it's overwhelming 100% when I tell people I do that. But it's leading them to say that they can do it. So normally I'm not going to say, let's get right on this. Let's prep, 21 meals, because that's like, wow. It start with 1 meal a week. So for a lot of people, it's like, what do we start with breakfast? Or if they're going to do the protein shake at breakfast, I'll say, what can we make during the week that's going to be easy for you that we can make multiple meals out of? For somebody, it might be as simple as just throwing in a bunch of chicken breasts into the crock pot and then letting it cook and then shredding it. And then from that, we're going to make quesadillas. We're going to make a chicken taco. We're going to make like a buffalo chicken dip. I mean, it depends on the person, what they like, but simplify it. Start with 1 meal, do that for 2 weeks. All right, now let's transform that into what can we prep for lunch? One tiny step at a time is so much easier to digest than I have to prep 21 meals.
Right. I think that's a really important point. It's something I've seen newer coaches do, where they'll start to talk to somebody and they'll flood them with information about what they do, right? Because as a fitness coach, chances are they're pretty fit. And they'll tell them all the things that they do and all the things that they make. And the person's eyes just kind of glaze over. And by the time they walk out, they're not quite sure what they were supposed to hold on to.
Right. When we lost all the content. Yeah.
Right. So, if I had to guess, I'd say keeping it simple, knowing they trust you, you're there. Right. I think, so which is kind of full circle. What do they walk out with? Protein, trusting you, right? And get off that scale. It's fat loss, not weight loss.
Correct. And I think that's the hardest thing for them to understand is it's not weight loss, it's fat loss. So what's actually kind of cool about our office as well, I know you can't see it because you're not here, but by our checkout, we have monthly recipes that I post.
I like that.
And I print them. They also go right onto our hospital website. So that way, if somebody's in between appointments, again, needs to mix it up, they have that support. But I can't tell you how many times people aren't even seeing me. They just see Dr. Bala for thyroid and they're like, are those recipes up? I want to grab some on the way out. So it's always like that one thing they take with them. So you're still here.
Nice. Is that something that I could get copies of? Are you open to sharing some of those recipes? Because
totally.
One of the things that we're doing on the Cornerstone side is we're revamping our website experience.
Yeah.
Overdue,
Okay.
and adding in more recipes and ideas and tools, so in general, because what we tend to teach is, here's your guardrails: protein, carbs, fat, and stay in
Yep.
those guardrails. But it is really nice to give people ideas, and socially, culturally, everybody's not going to eat the same. But
Correct.
but that's nice. So I'd love that if you had some. So
Yeah.
and I know you've got a patients coming up, so I won't keep you longer. But any parting words of wisdom for a coach that is coming on board to run a Cornerstone Wellness program, looking at body comp, going through the supplements, and you've been doing this for years and years.
Yeah.
Is there any challenge that you or thoughts that you'd want to share to somebody new or starting out?
Um, so you kind of you have to baby step it. It sometimes gets overwhelming for me some days. But I would say first things first, you always have to connect with your people. You have to hear what they're telling you. So if they're telling you they're struggling with something, you have to be their light.
Right.
Believe it or not, you have to find a way to be their light. Um, if they need that additional support, tell them they need to come in more often. I feel
Right.
like a lot of times if someone's really, really struggling, they need that more one-on-one repetitively. So
Mm-hmm.
if they're communicating with that, I would say that. Make sure that your clinicians are, tightly wound with what you're saying, because I think when I first started, it was hard for me to understand everything with diabetes. It's a lot.
Mm-hmm.
But the more that you get comfortable with that, I think the better if you're in an endocrine office, because doctors don't really have that nutrition background. When I first started, I remember patients would be seen by the nurse practitioner, and the visit with Kristen would be like, "You're eating too much. You need to eat less," and that's what all the patient would hear. And then they would come in with me, and they would be like, "But you're telling me I need to eat more of this food, and it seems like it doesn't connect." So you have to be on the same page with your clinicians. They have to understand the message you're sending. And I think sometimes if you're not connected, that gets lost, which creates distrust with your patient. And I think we do a really good job of that there.
Yes, you do. Yeah, yes, you do. Do you, and again, your clinicians are very wellness oriented and
Yeah.
always have been. But do they see the patient outcomes? You're charting it, obviously. But when
Yeah.
you have these great success stories, are you kind of sharing tidbits of that with the providers as well? Do they see when somebody came in a wheelchair, now they're
Yeah.
170 pounds lighter?
Oh yeah. Oh yeah. Big victories there. Yeah. And we're trying to be better at our hospital as a group in general with that, because of the referrals we get outside of our office. But we're trying to close the loop and be more supportive to, hey, this patient's been with us for a year. You referred them over for,
Right.
diabetes, and this is all the accomplishments we're also seeing outside of that. Um, we're actually going to be starting a wall in our office of
Nice. I
all of
love
these,
it. Yeah.
like their befores and afters.
Yeah.
So that's kind of fun too. But
Do you actually take a picture of a person when they first come in then, or do you wait till they're successful? And because I know people don't always want a picture at first, but and you've got dozens of these people, I more.
yeah,
Yeah,
probably over 100 at this point for
I
sure.
love it. Yeah. With
Um,
serious success.
yeah,
Right. Yeah.
yeah,
Yeah. I mean, I always, especially with the GLP-1s, I worry when people lose a lot of weight, but you don't see their body fat change much. And you just know it's going to sabotage them ahead, right? When, if and when they stop and 40% comes back as fat.
right, right,
So,
yeah. And I think we've seen that clinically too, and that's kind of where I think I'm being utilized more than what our diabetes educators were. Which is kind of cool. And I think that would be a point that you could talk about as well. So I'm not a diabetes educator. I do not have any of that credentialing, but sometimes with insurance, if you have someone who isn't able to run it through their insurance for that reason, we can run it through under dietary counseling and surveillance and get it covered. So
mhm.
that's another, again, supportive tool if someone's struggling financially and they can't, have that conversation.
Right,
Um,
right.
And we did used to do the screening with these, Julie, where we would, any patient who was coming in
I love
periodically,
that.
we were
Right.
screening and just offering it as, here's a really cool test that you can have to be done. It lets you know, a little bit more than your BMI, how well your health status is.
We call it a fifth vital sign, right?
Yeah.
So what you're saying is patients as they come in, even if they weren't seeing you, the office would do a body composition test, right? Because if their body, if it's out of healthy range, that is an underlying driving risk. Okay, so the clinicians would have that conversation. They would have the test. Okay, so it's not that you would go into each office and test. They are actively partnering with you in the conversation. That's huge.
Yeah. Yeah. And I think our office is so open door policy that works well too. So if anyone brings up weight loss, if they talk about wanting to get healthier, both of the clinicians in our office will say, we will not be prescribing isolated, just weight loss medications. We need you to be a part of this program first if we're going to do it. So there's stipulations that come in with it, but that is a great way if your patient volume is lacking at certain times of the year, offer that as a free tool. And then we have like a print off that says, here's what a healthy percentage was. Here's a print off of what yours is. And then we have that little flyer. Here's information on the program.
Perfect. So it's a screening tool. So if people need more patients in, you screen, right? Anybody, we always tell clinics, anybody with a BMI over 30, anybody with metabolic syndrome, right? Screen them. And then, because that should be a flood of patients. I mean, you're full with your program. And that's just one other point you just touched on. So before the providers are putting them on GLP-1 meds, at the beginning, not after they lose weight, at the beginning, they're having them come see you.
Yes. And I think that's why we've been seeing such fantastic results, because we weren't really necessarily always doing it that way. And we were seeing people lose weight. But the complaint was like, I feel like I lost my stamina, or I feel like I lost my endurance. And so they started pushing more patients over to me so we could actually see, as we titrated them up on the GLP-1, depending on how their diet was, how successful actual fat loss was versus that muscle tissue loss. We've helped really, I think, prevent that dramatically.
Right. Megan, it is such a pleasure to be able to interview you. Thank you, because you really do set the bar in every respect. So much appreciated. I'm going to share this. I look forward to seeing recipes because that would be great.
We've got a whole bunch.
Cool. And we'll be getting our site uplifted. So that's great. I think really we covered so much. So I really appreciate your time.
Yeah, absolutely.
And we'll talk soon.
Okay, sounds great.
All right. Thanks, Megan. Take care. All right.